So one of the concepts you have to make sure that you know is an acronym called ALARA, and it's known as the ALARA concept, and it's ALARA, and it stands for as low as reasonably achievable. And the whole purpose of this concept is basically it's put in place to make sure that we're doing all that we can to minimize the exposure to radiation for not only our patients but also to ourselves as the operator. So that's going to be doing things that this chapter talked about, as far as using the lead apron and the thyroid collar, using the fastest speed film that you possibly can, which we know is F-speed film if your office is still using conventional film, that you're making sure that you're processing your film appropriately and making sure you're not touching it, or making sure that you are using it the correct way that it's supposed to be used, that you're staggering as you're processing to prevent overlapping, that you're checking your developer and fixer solutions to ensure that they're where they need to be, and also your water level so that there's no issues when it comes to the processing, which can lead to potentially retakes. Again, if your office uses digital sensors, we know those to be a lot better than conventional film. But also doing things like making sure the equipment is functioning properly, making sure that it's inspected when it needs to be inspected, and there's the filtration, the collimation that is required. And again, remember, there may be some changes coming up when it comes to the type of collimator that we're using. They are wanting us to potentially move to the rectangular collimation, which again is going to help to reduce the exposure of radiation that's being emitted from our machines. It's making sure that we're setting the appropriate exposure time. That's one thing that we do have control of. Making sure that you're switching from posterior to anterior when you're working on the anterior teeth, or vice versa when you're working on the posterior teeth, to again prevent the need to do any retakes with your patients. To make sure that you're using, if your office supplies them, some sort of beam alignment device like the XCP, that you put them together correctly so that when you look through the aiming ring, that film or the sensor is going to be centered directly into that aiming ring, which will eliminate the need for retakes. And that you're following appropriate techniques, whether it's bisecting or paralleling or the bite wing technique. You have to be knowledgeable and proficient at being able to do that. And then of course, monitoring. Not all offices will provide some sort of personal monitoring, but just know that whether you are monitored or not, that you are standing 6 feet away, that you are not holding the film in place while somebody else is exposing it just to get the shot that you need. Again, have the patient hold it if need be, but we again want to try to eliminate how much exposure we're giving to our patients. So if we can use some sort of a device to assist us when we're taking those x-rays, that's going to be much, much better. So again, the concept is known as ALARA, and it stands for as low as reasonably achievable.